Hi, I'm Christian Brindle, and welcome to the Everything Medicare Podcast. What's up, Everything Medicare Podcast Nation? Welcome to another edition of the Everything Medicare Podcast. This is episode 134. Wherever you are and however you might be listening, thank you so much for listening. Every single week, I bring you 3 podcast episodes where we discuss your Medicare, your Medicaid, your Social Security, and everything that has to do with that golden age called retirement. And folks, we're doing our podcast episode today, which is Wednesday, Saturday, and then like I've been mentioning, like I've been telling you, we're going to be off for 2 weeks. And we'll be back the first week of January, so just keep that in mind. For those of you who don't know who I am, if this is your first time listening to one of these episodes, I own a company called Christian Brindle Insurance Services where we work with people in 7 states. I repeat, 7 states on their Medicare health plan. We work with people in Utah, which is where we're located, just outside of Salt Lake City, Texas, Florida, Oregon, Idaho, South Carolina, and Colorado. Again, that is Utah, Texas, Florida, Oregon, Idaho, South Carolina, and Colorado. And folks, we work with some of the biggest and largest insurance companies available in the industry. Okay. We do Medicare supplement plans, Medicare Advantage plans, Medicare Part D drug plans, dental vision hearing plans, life insurance plans, all different kinds of things. Although life insurance is more of our secondary focus for us, Medicare health plans is our specialty. I've published 2 books on the topic of Medicare, and we've been doing this podcast for about 1.5 years now, and it's become quite the following. It's probably the most popular Medicare-centric podcast on the internet today, if not number 2, depending on the platform that you're looking on. And we broadcast on 15 to 20 different platforms, including Apple Podcasts, Google Cast, iHeartRadio, Pandora, Anchor, Stitcher, Spotify, Castbox, YouTube, and I could just go on and on and on. And thank you so much for listening, however you might be listening, folks. Last week marked the end of the Medicare open enrollment period, but there is a plan that's coming out next year. I didn't do too much informational episodes about it because I don't really think it's much of a plan as is. Over the years, they have done, primarily speaking, a lot of high deductible plans over the years. Medicare has. They've had versions of very popular plans that were known as high deductible Medigap Medicare supplement plans. For example, we've had a high deductible plan F for years now, amongst other things. Now, starting in January 1st of 2020, in some markets, in some states, some insurance companies, only a couple insurance companies I've seen in my home market is going to have it, but they will have a high deductible Plan G going into next year. And basically all this means is it's the same exact plan as a regular Plan G, with the exception that it has a high deductible attached to it, hence the term high deductible Plan G. And that high deductible in 2020 will be $2,340. So basically the plan will not pay for anything until that deductible's met. Then after that, it acts as a regular Plan G, which means you still have to meet the $198 Medicare Part B deductible afterwards. Now, a high deductible Plan F works similarly, except for you don't have to pay the Medicare Part B deductible, but you still have to pay the high deductible of $2,340. Again, $2,340. So why would someone want a plan like this? It's a Medicare supplement plan with a deductible. Why would somebody want a plan like this? Well, high deductible Plan Fs have never been a very popular thing. They've been around forever, and high deductible Medicare supplement plans have never been big sellers, ever. And I don't expect this high deductible Plan G to be either. Why would someone want a plan like this? We're going to have to wait till segment 2 after a quick word from this sponsor. Got to take a break. I'll tell you why someone would buy this plan, what the thinking behind it is, and why I think it's absolute hooey. in most cases. I just don't think they're very good plans, but I'll leave that decision up to you. Don't go anywhere. I'll be right back.
What's up, everybody? This is actually Randy W. Hall, Mr. Nice Guy Medicare Advisor, not Christian Brindle, your esteemed host. I'm here to tell you about my Medicare agency, Mr. Nice Guy Medicare Advisor, based here in Tennessee. For the past 10 years, I've been helping Medicare beneficiaries just like you in Tennessee and Kentucky maximize their Medicare. If you're a regular listener of this podcast, you know Christian always encourages you to deal with a broker in your state who sells all the different plans and will give you not just a quote, but also advise you and educate you in a way that is simple to understand. We know how confusing and overwhelming the whole process can be. We do it all for folks on Medicare, from supplements to Advantage plans, Part D, cancer products, hospital indemnities, and more. So if you want to get a free quote or a consultation, I urge you to call 615-578-5174. Again, that's area code 615-578-5174. Or for more information, you can visit my website and read all about me at MrNiceGuyMedicareAdvisor.com. That's all one word, MrNiceGuyMedicareAdvisor.com. And again, why deal with a jerk when you can deal with a nice guy?
Welcome back, everybody. Thanks so much for sticking with me through that break. This episode's going to be shorter than the average episode because this is kind of a short topic, but I wanted to do one episode about it before the end of the year because these are new plans that are going to be available January 1st of 2020, and a high deductible plan G has never been available before. But does it really matter? I mean, think about it. Okay, so the reasoning behind picking up a high deductible Medicare supplement plan is this. It's a significantly lower premium. So let me give you an example. Let's say a regular plan G would be, I don't know, $120 a month. It depends on your market, okay? So in some markets that might be $200 a month. It could be $300 a month. It could be $150 a month. It could be $90 a month. It depends on your market and what's available. So I'm just using a scenario, so be sensitive to that, please. But let's say a plan G, for the sake of example, in a certain market is $120 per month in premium. A high deductible plan G instead might be $30 to $40 a month in premium instead. So it's a lot cheaper than a regular plan G. The thought behind it is you have that deductible, the $2,340 deductible next year. And after you pay that, you have all the benefits of a Medicare supplement plan, basically. So if you have a tremendous amount of health problems come up, you can be in a situation where you still have the protection of a supplement after you fork out a bunch of money out of your pocket first. I guess that's the thought. I guess that's the idea. And you save a lot of premium in the process. You don't have to shell out the extra premiums for Medicare supplement, but you still have the protection, I suppose. Here's the problem with that, folks. Here's the flaw. The flaw is this. In my opinion, now this is just my opinion. This is just one person. This is my humble opinion, folks. Of course, this whole podcast is my opinions about things and the way I look at things. Because I've been doing this a long time. I've worked with a lot of people. My company's worked with a lot of people in various different places. We're starting to get all over the country now. I mean, we're in 7 states. I mean, at the beginning of this year, folks, we were in 3 states. We took on 4 additional states this year. That's a lot of growth. That's a lot of growth, as far as widening our horizons a bit, if you will. But I've seen a lot of things, and I've never seen a situation where someone would be better off with a high deductible Medicare supplement plan than they would be with a Medicare Advantage plan. Because you add that deductible on, basically the plan is not going to pay anything. The Medicare supplement plan will not pay anything until you've met this high deductible. So, in my opinion, I think you're better off with a Medicare Advantage plan because the Medicare Advantage copays in most cases are going to be lower than what you'd have to shell out for that high deductible. In a lot of cases, you can save even more premium and get better coverage. Not to mention, you can get your prescription coverage included, whereas with a high deductible plan, obviously, with any Medicare supplement plan, you have to pick up the drug coverage separately and pay an additional premium for that in a Part D plan, and dental, vision, hearing, and anything else you want on the side of it. Whereas with Medicare Advantage plans, the drug coverage at least is typically included. The dental, vision, hearing may be good. It may not be good. It depends on the plan and your market and all those fun things. So that's kind of more of a gray area. But the drug coverage is almost always going to be included. There are versions of Medicare Advantage plans without drug coverage, but they're few and far between, and they're only good for certain situations, like people that have TRICARE for life, veterans benefits, people that have maybe a federal plan, something that they're pairing it with that also has drug coverage. Now, so if you have a high deductible plan G, let's say for the sake of example, it's $35 a month, and you pay an extra $20 a month for your drug plan, you're really paying $55 a month for a plan that won't pay anything until this $23.40 deductible has been met. It's ridiculous. You can save, if you want to save premium, take a Medicare Advantage plan instead. It's going to be better coverage than a high deductible Medicare supplement plan, point blank, and you save even more money. I don't really see high deductible plans very useful in most cases. Have we done them? Sure. Would we do them if someone asked us to? Sure. Do I think they're very good? No. Because you're paying more premium than a Medicare Advantage plan. Medicare Advantage plans are basically going to charge you, simply put, a copay for every time you use it. $5 to $10 for a primary care visit. $40 to $50 for a specialist visit. These copays can be higher and lower in certain markets, but you get my point. $80 to $90 for an emergency room visit. $150 to $300 per day in the hospital for the first 4 to 6 days, and then after that they pay everything. So they limit you down to a copay, and the Medicare Advantage plan pays the rest of the cost for you using it, for whatever procedure or usage you're having for it. Whereas with a high deductible plan, if you're paying all of the out-of-pocket the supplement would have paid, up to that deductible per year. Plus, it's going to be, in most cases, in most markets, more premium than a Medicare Advantage plan would be, because in a lot of places, you're going to have $0 premium Medicare Advantage options available. Not my cup of tea, folks. But I wanted to do an episode about it, and that's why we didn't do it during the Medicare open enrollment period, because, it was coming out in January, but my thought process was big whoop. Big freaking whoop. I think the same thing about the high deductible plan G as I thought for years about the high deductible plan F. Yawn. Some people might find the appeal of these, but I don't see it. I never have. I'll do it for somebody if they ask me to, but that's my thought process, folks. High deductible plan G. Thanks so much for listening, folks. I hope you got something out of this episode. Just know high deductible plan G will be available for effective dates starting January 1st, 2020 with a few different insurance companies and going forward. So it's basically a plan G with a $2,340 deductible attached to it, and then after that deductible is met, then you get the perks and the benefits of a plan G after that. So you have to shell a bunch of money out of pocket in medical bills before you really benefit from the plan. I don't see much there to it. It's not too much more complicated than that, but it's a new plan available for next year. Thought we'd do an episode about it, but like I said, yawn. Thanks so much for listening, folks. This is probably one of our shortest episodes ever, but there's not much for me to say about this. Pretty simple. High deductible Medicare supplement plans. As always, folks, thank you so much for listening, and if you're listening to us on a platform that will allow it, please do me a favor, leave us a 5-star review. It helps us reach more people just like you. Millions of people all over the country are confused about their Medicare. I'm at a goal to basically solve that dilemma for as many people as possible. That's what our organization is all about. We're one of the few organizations out there that puts out content on a regular basis, and when we do a podcast, they're not 5 to 7 minutes, like a lot of podcasts out there. We're not the only good Medicare podcast out there, but, well, damn it, I think we're the best by far. I think it's kind of flaky, personally, to do a podcast once every blue moon. There's so much information out there, I'll never run out of content for you folks, because there's always new things changing, there's always new things to know, and there's always new things that you can implement into your lives to make your Medicare journey that much more effective and to squeeze every drop you can out of your Medicare. Because you've earned it. Thanks so much for listening, folks. We'll be back on Saturday with a longer episode that I'm excited about. Talk with you then. Thanks so much for listening.